A new COVID-19 booster vaccine has been approved for children who are between the ages of 5 and 11.
This booster dose provides a great option to restore protection for this age group, especially for those who are at high risk of severe illness.
So this booster shot could help keep cases down as we head back to school, but not everyone is lining up to get one. For more, we are joined by infectious diseases specialist, Dr. Bogoch. Doctor, nice to see you.
Great to see you, Lindsay.
Let's talk about this age group. It's thought to be the least vaccinated group in the country. We're looking at a stat there. Only about, 42% of people in that age group have received their first 2 doses. You compare that to 99% of people over the age of 80. So what do you make of that?
Yeah, there's probably a lot of reasons that are driving this. Some of those reasons might be that kids just tend to not get as sick as adults. Of course, we know kids can still get sick, and we've seen a rise in pediatric hospitalizations, but compared to the older cohorts in general with COVID-19, they just don't get as ill. And in addition to that, we know that there's some protection, some immunity you get when you recover from infection that helps protect you against future infections, or at least might mitigate the severity of future infections. And I think stepping back as well, I think parents just want to do what's best for their children. And, some parents jumped in with 2 feet when vaccines became available for this age cohort. Others still have lingering questions or concerns. And I think it's important that they take their time to get those questions and concerns addressed. And that might mean watching the data, speaking with a healthcare provider, et cetera. So, well, I think, with time, we might see some more vaccines in this age group, and certainly we'll see some parents come forward for this booster that's now available as well.
And when we think about this age group, who within this group should really be getting their booster?
Yeah, the National Advisory Committee on Immunization and also Dr. Theresa Tam, Canada's Chief Medical Officer of Health, came out very strongly recommending this vaccine for kids who have underlying medical conditions that put them at greater risk for infection. And there is a strong recommendation that these children who are at risk for severe COVID get this booster vaccine when it becomes available, which will be very, very shortly in most parts of the country. And I think that's important. Like when we look at which children are hospitalized with COVID-19, it is disproportionately these children with underlying medical conditions that put them at risk for severe cases of COVID. So these are children that should be getting this vaccine.
Each school year during the pandemic has brought different challenges. What are your biggest concerns as we head into this school year?
Well, I think we're going to see cases rise in the fall at some point, and certainly in the winter. We've got, Canadian winters are a little tough. We all know that. It's cold, people are indoors, and we're going to have a lot of people in indoor settings, not just kids back at school, but adults, unfortunately, back to work as well. And, there's going to be a lot of opportunities for this virus to amplify. And, we're also probably going to have a flu season as well this year. We certainly saw the Southern Hemisphere have a flu season, and usually we're going to get something similar to what they get. So we'll probably have a flu season as well. And, we've heard time and time again about how our healthcare system is really stretched. And there's significant challenges with staffing in the healthcare system. So when you factor in so many different things, the regular ailments and the slips and falls that happen in the winter, a COVID season, flu season, other respiratory viruses that we get around the winter, plus understaffing in healthcare, I think, sadly, we're going to have a bit of a challenging winter ahead of us.
And Doctor, without provinces tracking case numbers in the way that we were used to over the last little while, how will you and other health experts monitor how well the school year is going?
Yeah, well, we'll look at the same metrics that we've done since about the spring when PCR testing in the community was scaled back. So there's a few things we can look at. One is looking at the wastewater surveillance signal, which is helpful. Of course, no one test is perfect, but it is a helpful metric. And we also can look at hospitalizations as well, looking at those who are sick enough to land in hospital and use that as a metric. And certainly the tests that are being done in the community aren't nearly as great as they once were, but they're at least consistently done. And we can look at some of the metrics around those tests as well that really help all point and paint a bigger picture as what's happening in the community.